Welcome back to Connect for Health, the monthly webinar and podcast series that enables you to live a healthier life. Brought to you, of course, by Cigna Healthcare Middle East and Africa, with a little help from Mental. I'm Scott Armstrong. I'm the founder of Mental, a platform designed to tackle the stigma of mental health. And as always, I'm joined by my fabulous co-host, Mesa Al-Kafaji, the head of government affairs and strategic communications, and I got that right this month, with Cigna Healthcare. Today's session is a really interesting one. It's a topic that affects all of us, whether we know it or not. Even the healthiest of us will have to go to the doctor from time to time. But how educated are we about what we're told, and what are we expecting when we walk through the door? So our topic today is unlocking health literacy, how to take control of your health and your health insurance. Now, a quick reminder, this session is streaming live for Cigna Healthcare members. If you're watching on the podcast or on the YouTube, you won't be able to get in touch with the interactivity. So remember, we want your questions if you're dialing in live, and we'll have the polls. If you want to join us next time live, reach out to Cigna Healthcare for details of membership. Now, our guest today is a very special guest, Dr. Johannes Wimmer, who is a medical doctor. He is a best-selling author. He is a TV host and a leading voice in digital health education. And he's known for translating complex health topics into simple, accessible language. No pressure there. Dr. Johannes, thank you for joining us on Connect for Health.
I'm very happy to be here. Thank you, Mesa.
Let's start with the basics. I always go with a kind of helicopter view. Health literacy. It sounds something that's very academic. What actually is it in real life?
Health literacy is pretty simple. Know what you want and know how to get it. When you see a doctor, when you go to a pharmacy, when you treat your own ailments, it's not being as smart as your doctor in medical perspectives. So you don't have to study medicine to have high health literacy. It's about your wishes and how to get where you want to be. And that's pretty simple.
Okay.
How educated are we in general, would you say? I mean, there's a lot of information out there, but when we talk about health literacy, and actually people, when we walk through the doctor's door, are we educated about what, in our life? I mean, this podcast and webinar series is part of health literacy. So hopefully we've got very educated people dialing in today. But what is our general level of health literacy you see in the world today?
Yeah.
Health literacy doesn't mean that you are very academic or very smart. I would say that my grandmother probably had a higher health literacy than many other people today who are lawyers or, like teachers or in the government. So just because you know something well and you're an expert in your field, like a lawyer, doesn't mean that you're good in health literacy. Health literacy means that you, as I said, you know what you want, you understand what you need, you may be even able to interpret what your body is telling you. I mean, we are all living a life, especially in the Emirates, in Dubai, Abu Dhabi, as expats, etc., where stress is a constant. We're trying to push the limits. We want to be independent. We want to prosper. And we don't hear how our body and soul is whispering to us. And at some point, the body is screaming at us and giving us signs which are unmistakably red flags.
Yeah.
So understanding your body and understanding your health before it becomes a problem would be like the biggest step. And that's something which we sometimes have to relearn.
It's interesting because when I was thinking about the topic today as health literacy, coming from, maybe it's a bit of a subjective background because I have a background in healthcare as well. To me, it is understanding the healthcare system. Sorry, I have a tickle. But you're saying that it's really understanding your overall health.
I think it starts with,
Sorry, I'm tickled.
Mace is just proving that this is a live broadcast.
Please continue. I just have something in my throat.
So it's about it's about the time you're not at the doctor. So it's for the time before and after. Even if you have a chronic illness, 99.9% of the time you'll be alone with your disease, with your problem, with your health issue. There will be no medical expert around you. So the important thing is that you know how to handle it and you know what you want. There's many options. Being a medical doctor and having treated lots of patients, I always found it best to work with people when they said, well, what are the options? What is best for me? I think it's absolutely fine if somebody says, well, I want to live a certain, in my eyes, unhealthy lifestyle. If they know about the consequences, it's their freedom of choice. And then I would rather try to find something which is fitting their lifestyle than trying to tell them what is best by the textbook. So it's about knowing where you are, what you want, and how to get it. And that's, I think, a huge aspect is certainly not only, knowing about your daily habits, and we can talk about routines, but also how to present yourself to a doctor, to a health professional, to a pharmacy, to the ER, and also know what to do after you left a hospital or doctor's office.
I love that about kind of like the before and the after rather than in the room. And let's stay outside of the room for a moment. Let's not walk through the doctor's door just yet. I was also fascinated when you said like your grandmother might have better health literacy than us today, and we've got so much information. What's that kind of difference? Why would your grandmother have had better health literacy as opposed to all of us, the younger generations perhaps, who have so much information at our fingertips, but yet perhaps don't know ourselves, or as you say, don't know what we want as much? What's that difference?
I think the biggest problem with information is information overload and distraction. So nowadays, because everything is so convenient, if you live in Dubai, everything happens by the swipe of a thumb. You order something and it will be delivered in 18 minutes. Sometimes that's even considered slow, and it's 6 minutes. So it's absolutely crazy how soft and comfortable life became. And we think that it's the same in health. And the information we get online, especially in social media, is we get sold a lot of silver bullets, quick fixes, miracle drugs, miracle diets, miracle supplements, cosmetic miracles. So we think that health is easy. Unfortunately, it's not. And our grandparents knew that health would be something you would have to work for every day. And by doing little things every day, small steps, small decisions, choosing the healthier food option over the unhealthy one, walking stairs instead of taking a lift or an escalator, listening to your body, taking a walk after dinner, small choice instead of sitting down on a sofa for 2 hours. That's how they understood that it's working. And learning by doing, they felt the feedback instantly.
See, now as we're talking, I've this is almost like an epiphany, a realization that there is a lot of information out there, like you said. There's a lot to digest. So there is a lot of information that people can refer to as health literature. But the idea of actually processing that information and actually applying it, making the effort for lifestyle changes, that's what's lagging. Because I know that the convenience of you saying that, whether it's a pill, whether it's a patch, whether it's an injection, people will only limit their knowledge to just that solution, but they will not look into, say, root cause, things that would be more effective in the long term if they were to make those changes and stuff.
Because it can be uncomfortable.
Yeah.
And it's not like I'm the perfect example. I mean, I could also move more. I could eat a bit more healthily. I could, look more after my stress level. I could get more sleep. So that's the choices we see. But then again, you need partners to help you when you don't feel well, like a doctor, like a pharmacist, like a physiotherapist. I mean, we always talk about doctors. I think they are just a placeholder for all these wonderful medical professionals we have out there.
Yeah.
And then also, you need a health insurance who is not an health insurance like in the old days where you were, like almost praying that they pay or expecting they pay everything. It's a partner. It's a partner who's trying to help you to live a healthy life, to get back on your feet, and also trying to keep it reasonable for everybody. Somebody has to pay for it. And if we overspend because we think, well, I can do this and I can do that, although it's not medically indicated, there's no need, then things and medicine might get very expensive for us.
Sorry, I'm trying to clear my throat, but I had a question. Excuse me. So I wanted to actually expand on that. because I know that we were just kind of reflecting on how living abroad, living in the UAE, standards of living, cost of living, people come here because they feel that it's a better quality of life, it's safer, but then people always look at the healthcare system, access to healthcare, how reasonable it is. How does lack of having that sense of health literacy compound things like overall cost of health for a whole population and community if people are not aware?
This is my personal opinion, so I can't speak on behalf of the doctors or on an insurance.
Yeah.
I think right now which is astonishing from a medical perspective or healthcare perspective is that in Dubai, particularly, it's almost like the other way around. So if you're in Europe, you will have to wait for a doctor.
Yes. Yes.
Yeah.
Sometimes you will have to wait 6 weeks. Here, you can get an appointment the very same day, maybe at 8:30 p.m., regular outpatient, everything running, no emergencies. It's just like the service they offer to you. I heard that there's more than 3,000 medical doctors doing cosmetic procedures in Dubai, which is also outstandingly, many. So people understand healthcare more like a service, which is being paid for by somebody else. And I talked to people who said, well, I go to this specialist because in the same mall there's a Gucci store and they have valet parking. It's convenient.
Wow.
Well, it is convenient, but that's also it's the wrong approach. So healthcare, unfortunately, is not like buying something what you like. I think you should always try to get to the expert, which is the best expert. That could be a family practitioner, could be a GP, or the expert. Sometimes it's good to get a second opinion, sometimes it's not. And especially, again, if it's just convenient to get there and have everything taken care of. This is how we have a tendency to overspend.
Yeah.
And that's something which we will feel by higher premiums. If you're self-employed, you'll know how much that can be. If you're employed, you'll actually understand that more of your paycheck might be getting into the healthcare benefits.
Yeah.
I'm going to just, again, pick up on that because I want to ask a question. Like, is there again, before we walk through the practitioner's door, are there kind of like almost like two things going on? Because in your grandmother's day, and even as you say in Europe, where people have to wait, health literacy was something that was born out of necessity in a way, that people had to make, more effort outside of the GP's room to look after themselves because the access wasn't as good. Whereas here, the access is incredible and world leading. So here, there isn't that necessity. You can just go and see a doctor at the drop of a hat. And at the second time, is health literacy harder now because there's so much more choice and so much more visibility? As you say, there are other podcasts where you have pseudo experts selling a solution left, right, and center. We've never been presented with so much information and so many options. So is that literacy harder these days, perhaps for younger generations than it was? But also, is it harder to kind of educate yourself because you don't need to as much?
I think that's absolutely true. If even if you take all the miracle drugs and diets and supplements away, the medical knowledge, back in the day when I was in medical school, it doubled every 5 years. Now it's doubling every 2 years. So even for medical experts, it's not easy to keep track. It's not easy to have a high standard of health literacy for themselves and provide it to their patients. There's so much stuff out there that we, as medical professionals, we rely now on AI tools to be able to find the proper solution quicker. Nobody is expecting, when I was in university, they expected us to know everything. It's impossible as a medical expert to know everything. And how should a patient know everything? Then on the other hand, some patients become more of an expert in their own disease than any doctor they visit because they spend more time reading up on that disease. And it's just a difference on how you do it. So while some say don't Google it, don't use AI, don't use ChatGPT, Perplexity, etc., I think it's marvelous. It's just how you phrase it. So don't just type in, I have these symptoms and what do I do? If you have a diagnosis from your doctor, let's say hypertension in a certain degree, why not ask an AI tool according to guidelines from the US, from Europe, medical guidelines, what should somebody do in this case when presented with what your doctor told you. You can even like type in your ICD-10 diagnosis code. And then the tool will look for proper solutions and not what's screaming the loudest online. So health literacy has never been as easy as today, but also never been as tempting to being steered into the wrong direction.
I absolutely want to circle back on that point just a little later in the conversation, especially around the chat GPTs and the complexities of
the AI tools. Yeah.
One more question, which kind of helps us walk through the door into the practitioner's office before we get to our first poll. And I can see some questions coming in. Please bring your questions in. Dr. Johannes is an expert, so you might as well take advantage of him while he's here. Think of him as a live chat GPT. For many people, the thing that will be in their head is, and particularly here, because again, we go back to the access here, I go to the doctor treats me. So why do I actually need to increase my health literacy? What's the point?
I think that's a brilliant question. Health literacy means that you get what you want. So you have to understand what you want first. And I think part of health literacy, which sounds so abstract, is maybe you should even write down what you want from the doctor's visit, and you don't leave that doctor's office before you get it.
Okay.
That could be a second opinion. That could be to decrease the pain you have. That could be a diagnosis you're looking for. That could be that you say, well, I need to have a sick leave for 2 weeks because I can't cope anymore. Many patients go to doctors eagerly waiting for them to read their minds, and then they leave the office and they are disappointed because they didn't get what they want, but they never asked what they wanted. So the first thing, which is very, very important, is to know what you want and articulate. Say, what do I want, and write it down. And then the second thing is also health literacy means if I'm your doctor and I will ask you or you, like, what's bothering you, be prepared to answer it in a good fashion. Again, you can even use AI tools. I would put it into incognito mode so that the tool doesn't need to learn from your ailment.
Okay, yeah.
So you just say, well, this has to be anonymous, or, like the tool doesn't learn from it. And then you say, how do I present these symptoms or these problems in the best structured way to a doctor, instead of asking ChatGPT what it is. You can always do that later. You can also do it simultaneously. But if you make it more easy for your doctor to help you, you'll get more out of that time. Let's say you have in Dubai, 20 minutes with your doctor, which is amazing compared to European standards. Those 20 minutes, he or she will always do what they do. They will provide the same level of care. You can increase the level of care. It's up to you. So if you come in and you bring your medical information, you know what you want, you know your questions, and you know how to present yourself, you will max out these 20 minutes to a fully different dimension than if you just went in and play it by the ear or see what curveball he's throwing at you.
Can I ask a follow-up question to that? Because you say you know what you want. Is that, I'm just really interested because you sparked this question in my head. Is that a case of us as patients walking in and knowing what we want in terms of treatment, in terms of medication, or knowing what you want to get out of that session, what you want to know? That distinction between going in with defined questions that you want the answer to going in with a predetermined diagnosis in your own head.
That could be something what you want. I mean, you could go talk. I wouldn't judge if you came to me and you said, well, I ChatGPT'd and I Perplexity'd and I put it in all these tools and I have these 5 different options which came out. What is it, doc? Tell me. Yeah. That's nowadays, that's a standard. Why not?
Yeah.
But I think you answered the question already to some extent is, know what you want from your doctor. Do you want a diagnosis? Do you want a treatment? Do you want a second opinion? Sometimes people go to a second doctor, to a specialist, and they never thought about why am I even going there? They kind of know why, but you need to tell them. And there's also no harm. You could even tell the doctor, I'm here for a second opinion. I hope it's fine for you that I don't even tell you, what I have, because I just want to, be like a blank canvas. Or here's the report from my other doctor. I feel it doesn't fit. Can you check? This is how you help the professional to do their best. And I think that's important, that you help the professional to provide the best service for you, that you get the most out of this visit. And that's about articulating what do you want from this visit.
I was just reflecting on, because I'm looking at it from where we are in this part of the world, and I'm thinking about generational. So I know that a lot of people who frequent the doctor's offices are going to be either those who have suffered chronic conditions, people of a certain age group, and I wonder how prepared they would be to have that level of health literacy. So say if I'm talking about somebody who is, in their early 70s, coming up close to their 80s. And for them, the doctor's visit is really just to talk to someone, complain about their ongoing ailments, and get their medications. So they don't really reflect upon things like, what do I really want? Do I want a better quality of life, or do I want, to just kind of like feel better within my whole being? It's interesting because I can connect with what you were just describing. I think back to my parents, for example, and I know for a fact that would not be something that they would be, not willing to do, but they're so stuck in their own habits and their own patterns and ways. They wouldn't even think about doing extra work, because it is, in essence, doing a little bit of effort and extra work yourself. Yeah.
Because you would also demand more from the semi-gods in the white coat. So with all these medical television shows back in the day, you would never doubt or ask something from a doctor. And the only thing you would have left is just to present yourself and hope to feel better afterwards. In these cases, and one has to admit that in the Emirates, compared to Europe, 1 out of 10 patients might be in their early 70s. In Europe, it's 3 out of 4.
Yes,
But in these patients, what I always like to do was asking them, what can I do for you? Like, how can I improve your situation? Sometimes, and I think that's also the task of the professional in front of you, is to help you articulate if you can't come up with it yourself. I mean, I can also just sit there as a medical professional and say, interesting, okay, let's carry on. Thank you, great, bye. Or you can say, well, I know you're 72, but how about, would you like to change something? Are you willing to adjust something in your lifestyle? Being 72, you don't have to, but shall we try this? And I think that's where the team play comes in.
Yeah.
And it's not up to you as a patient to be perfect in articulating it. It's also up to the doctor to open a door which you can walk through.
Yeah.
And I see in many professionals here in the Emirates that they are very professional in doing this.
I wanted to, because you connected me to a thought, and you've sparked even more. Obviously, one of the things we do with mental is try and have open and honest conversations around mental health, and try and tackle that stigma and that shame so people can talk about things. How important is it, before we walk through the practitioner's door, whether it be for mental health issues or whether it be for physical health issues, to be prepared to be open and to talk about these things? Because stigma can, if you say you've got 20-30 minutes with the doctor, it might take you 10 to 15 minutes to either warm up to that individual. The person across the desk may or may not be the most empathetic of professionals, but for you to then open up and go, yeah, actually this is the real cause, and I'm just too embarrassed to talk about what I wanted to talk about. But actually you've got a limited time with that professional, so if you want to make the bang for your buck.
I think when I started doing YouTube videos, probably like 12 years ago, every second video was on, it's okay to be ashamed. It's okay that you think it's very odd what you have, or nobody else in the world has ever had this issue. We as medical professionals, we've seen it all.
Yeah.
I would say it's hard to surprise me. If you talk to me and told me something happening in your family with yourself, I would say I've either seen it or I'm not surprised. And usually, if you've seen everything, you don't judge.
Yeah.
But that's hard for people. Again, I think that's also part of the medical professional, to make you feel safe and secure. I did the medical examination also in the US, where you have to prove to patient actors and a jury that you're actually able to communicate with people in a way that they can open up.
Okay.
Something we never learned in Germany. It's not part of the curriculum. So if you fail, then you will never practice medicine in the US. if you're not able to present yourself in a way that people feel they can open up, you will not help everyone to open up. And I worked in military psychiatry. It takes time, especially with soldiers. But it's a step into the right direction. And if, again, health literacy, if you're good at understanding your emotions, understanding I feel ashamed, that's why I don't go to the doctor. I mean, we can talk about good and bad health literacy. A bad level of health literacy would mean I'm so ashamed and my emotions are so dominating that I don't even go to the doctor.
Yes.
Wow.
And we always talk about I'm sitting in front of the doctor. Many people don't go because they're ashamed or because they're so afraid to hear the diagnosis.
Yes.
I've been diagnosing people with late and end stage cancer in the emergency room at night at 1 a.m. And I said, well, did you ever see a doctor for this? No, I haven't seen a doctor in 12 years.
Wow.
I'm going to come back to this literally after this poll because I want to stay with that as well. I think we should stay with that and that kind of cost and emotional literacy and healthcare literacy. But first poll of the day. If you want to get involved in this, please do. So our first question for you today, hopefully you'll see the questions come up. When it comes to health and healthcare, what do you find the most confusing? Is it A, understanding symptoms and when to seek care? It was really connects to what Dr. Johannes was just saying, knowing what questions to ask the doctor, understanding test results and medical language, navigating health insurance and coverage, or E, knowing where to start at all. So please get your answers in. We'll come back with the results in a second. Out of those 5 options, what would you think would be the top one?
I would click all.
All? We say this every time. There should be an F, which is all of the above.
You have to rephrase those questions.
I'm going to put you on the spot and get you to pick one.
I think the one with understanding your health coverage is depending on where you live. For instance, in Europe, it's fairly easy. The system is pretty straightforward and you're easily frustrated anyway, so it's fine. Here, it's very different. You can have different health plans in the family. You can have different health insurances in the family. And then understanding these, I would consider I'm part of the people who have trouble understanding their health benefits or their coverage. So I have to look it up as well. It's not like, I know everything.
Yeah.
See, that's kind of concerning when the doctor's like, I have no idea what's in my medical plan.
Because it's not medicine. It's not medicine. It's a formula act. It's a contract. It's a membership in a way. And it's complicated.
And it's like, how often do you refer to a contract or the finer prints in any kind of form? Yes, it's not something that.
But it's okay. It's okay that you say I don't understand. That's where at Cigna there's an app which can help you. There's fantastic customer service which can help you. And I would also say that if you think you are a good patient or you take well care of your health, you look into these things before going to a doctor. Because what also is a sign of bad health literacy is that you get surprised by bills. And I think that's a shame. If you go to a doctor and you get tempted by social media posts and then you think, well, I'll do this, and they say, you just hand in the bill at your insurance, and then it comes back and you paid up front, and the insurance says, well, that's not medical stuff you did. It's cosmetics or it's something which is well-being. We can't pay for this. If we paid for this and everybody who is asking for this, we pay for this, we would have double the premiums. That's the one thing. We could have a health insurance which is paying for every cosmetic procedure, but we would pay so much more money.
Yes.
And then again, you have to have the cutoff.
That brings me back, and actually it's interesting because I'll just go through the poll results as well. Actually, the top answer with nearly a third of people responding today is understanding test results and medical language, which is interesting. And then the next closest result is knowing what questions to ask the doctors. That really comes back to that health literacy point of view before we walk through the door, before we see the practitioner. And then the third one, very close behind that, is navigating health insurance and coverage. When we talk about health literacy and you talk about costs, let's talk about the costs of having health literacy or not having health literacy, because there's so many aspects to that. You were talking there before about the people that delay treatment, the people that don't go to the doctor, and then they leave it so long that does that treatment then cost more? If we look at health literacy, is it overuse and underuse, and how do we actually get to that middle ground? Like, what are the costs of not actually being health literate in your own life?
The answer will be a bit bigger than I think the one you're looking for, because cost can be financial costs, money,
Yes.
Yeah.
but you can also pay with your health.
Yes.
So you have like the cost you pay with your emotional, psychological, and bodily health, and you have the cost which you pay as money. So I think it's very important for people to understand if you go too late to the doctor because you are overwhelmed, if you don't ask the right questions, if you don't prepare, they can't do miracles. You might end up paying a price, which is not money, but psychological health, bodily health, later diagnosis, in the worst of all cases, shorter lifetime or more agony. So bear in mind that you don't do this for the doctor so that the doctor can pull off better work. You do this so that your burden gets relieved, or you stay in this healthy status you're in.
Yeah.
And then money-wise, it can get very expensive. I'm very bad at handing in bills. I always wait, and then I think, whatever. And so, but it's actually fairly easy to circumvent this trap of, paying out of pocket and not getting the money back. And especially in Cigna. Cigna is an insurance which has a huge network, so you can actually stay in the network, where Cigna is paying directly, so you don't even have to pay up front. You pay your copay if you need to pay copay at all, which is usually a very small amount,
and it's as per your policy as well.
And it depends on the policy, and it's usually not that big. And if you talk to the doctor and say, well, I don't feel well, and the doctor says, well, let's do some blood tests, the doctor might actually tell you, or if you ask, well, is everything covered, the doctor might be able to tell you, well, all of these are covered, but you wanted this one special test because you heard about it on social media. Let's see if this is covered or not. Do you want me to do it or not? And then you can say, well, how much is it? I don't know, 500 dirhams. And then you say, okay, let's do this. It's fine. And the insurance either pays or not, or no, let me please check and let's wait and to see if they cover it. That's part of the modern medicine, that you should engage into how much you have to pay on top. I think it's important because many people live on a tight budget.
Yes.
Yeah.
And again, if you go back to that shame and that stigma thing, there shouldn't really be any issue with people, because as you say, people are on different plans and products and have different levels of coverage and all that kind of thing. One of those shame and stigma things is actually turning around to the GP or to the practitioner and going, how much is this going to cost me? Am I covered?
I think
being able to ask that question.
No professional Dubai would look down to you and say, oh, what a silly question.
Yeah.
In Europe, different. In America, again, also absolutely. They will even send you a cost proposal if there's time.
Right.
And then you'll see a very big number and then hand that in. And that's something you can do here as well with Cigna. You can say, well, okay, this is this much, and then you ask for pre-approval.
Yeah.
We in medicine, most of the times you have time.
Yeah. I mean, like even 2 days ago, I just personal anecdote, just went to an orthopedic surgeon in Abu Dhabi. And basically he was very fast to say, oh, what's happening? La, 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 MRI. And I was like, I don't think it warrants one right now at this point. But anyways, yes, those things will require pre-approvals. But sometimes I think it helps to steer where the direction is going, like the direction that you're wanting to take when it comes to some of these tests and diagnostics. Without giving names. There was an instance where I had full blood works done, and the doctor who had attended, it's not my regular doctor, but didn't even bother explaining the results. And this is why I feel that sometimes people feel that the most confusing for them is the diagnostics and what do these test results actually mean, the ranges, and then you get into the nitty-gritty about, okay, but then there's the functional ranges and so forth. And a lot of patients feel that they don't get that from their doctors.
And they're interdependent. So,
Yes,
if you have like your blood works and there's like 5 values out of the ordinary, just seeing what they mean singularly is totally different from how they affect each other.
Yeah.
So that's where your doctor has to explain.
Yeah.
And, we're all humans. And when I saw many, many patients every day, I would be in a different state of mind after lunch.
Yeah.
Like, having worked for 6 hours straight and then eating quickly,
Yeah.
I'll be, maybe not as sharp as at 8 a.m. in the morning. And so if you then have a patient who says, well, I know you're busy and you have many patients, but I need to understand this, then I would say there's almost no doctor who wouldn't take the time to elaborate.
Yeah.
Sometimes they just forget. And because, we always want to show our best. As humans, you sit in front of a doctor and somebody's like, yeah, of course I understand. Yeah. It doesn't hurt the ego to say, it's not my field. Even me as a medical professional, if I go to see a specialist of a different kind, the knowledge I have is from medical school 25 years ago. 20 years ago. That's old knowledge. So I'm more than keen to learn.
Yeah.
And for me, it's not easy as a medical doctor to say, I don't have a clue. Man, you have to explain.
I need to bring in 2 questions.
Bring that in because I wanted to ask something afterwards.
But the audience is asking questions.
Okay.
Andrew's actually raised a good point and asked a question, which is, again, a sort of sign of modern times. And I remember this. When I was growing up, we'd go to a family doctor. You would go and see, particularly in the UK, you'd go and see the GP, and your GP would know your medical history. They would have seen you for a long time.
Yeah.
And what Andrew's making that point, but he's also saying, is it still better to keep a GP, like keep a connection with a regular GP who knows your history? Because we're so often going straight to specialists now.
Yeah.
We go, oh, right, I've got something with ENT. I'm going to go straight to the ENT person. We don't have that individual in our life that knows our life story in the same way that we used to. So how do we navigate that, particularly with all the...
It's hard to find a good GP everywhere around the world. But you need somebody who is like a sat-nav system for you, like Google Maps, who knows where to point you to and helps you where to go and how to get there. I would even say that telehealth services can provide a lot of insight. So if you have a certain issue and you want to see a specialist, why not check in with telehealth first? There's a doctor and they can elaborate with you if this is the right specialist you want to see or if you should go to a different specialist as well.
Yeah.
Because the one problem for Andrew is if you go to a specialist right away, that specialist has a scope like this.
Yeah.
Much deeper knowledge, all the specifics, but the GP has this.
Yeah.
And if he sees your issue and says, well, you belong to this specialist I was just pointing out, fine, you had the right clue. You were standing like in a game show on television. You were standing in front of the right gate.
Yeah.
But if you actually belong to this specialist, but you went to this one, he is doing his thing and he's doing his workups.
Yeah.
And you're wasting precious time and you're paying maybe even like a physical cost.
You'll have a copay at the very least.
Well, the copay, but even you might even your issue might not improve.
Yeah, yes,
So
absolutely.
you actually pay with bodily health because you went to the wrong specialist. So this is how it usually works. Somebody to navigate.
Yeah.
Then sometimes people, let's keep the regular Dubai problem. You think you know where to go to. So you go to that specialist. You're not satisfied with the specialist. So you seek a second opinion from the same specialty. So you're at a second specialist of the same specialty, again, doing all the workups, again, not being, getting the results you need. Well, you should have seen someone totally different.
Right.
So the GP, hopefully, a good GP would point you out to that specialist and maybe get a second opinion from the other specialist while you're in this narrow corridor getting you nowhere.
I hope that answered your question, Andrew. I thought that was an absolutely really good question.
Yeah,
That was
that's a
fantastic points there. I'm going to combine 2 questions. Nathan's asked a question and Anuja's asked a question. Anuja's asking, what are the suggested ways of improving my health literacy? And Nathan's asked, how frequently are we supposed to visit a doctor if we're relatively healthy and symptom-free? From that kind of preventative perspective.
Oh, wow.
Two good questions there.
Very good. And you want to combine those?
Yes. That's why we got the top guy in.
Back in the day,
You can answer them separately.
I did checklists
Yeah.
where you would be able to understand how do I present myself to a doctor.
Yeah.
Not only what questions to ask, what are the usual questions you should ask when somebody wants to do surgery on you, but also how to present yourself in a good way. Some people have a tendency to sit in front of a doctor and, like a good novel, they start, with the overall scenery and then they go into this one thread. Although they have this huge issue they should talk about right from the beginning, but then they talk about everything else, and the doctor doing their job are focusing on that issue, and you never talked about the elephant in the room or like your big issue.
Yes.
So you also should understand that, start with the biggest drama and then work yourself to the lower one. I would actually say that looking these things up on Google or with AI tools, they look for the newest ways in how to present yourself well. So don't ask like, what could this headache be? Ask, how can I present a headache best way to a GP or a neurologist so that they can work up and come up with a diagnosis the quickest. So that's where these tools are magnificent. And then they will write you something down and say, well, this is too long. Can you write it down in 5 points so I can print it out and take it to the doctor? The tool will do that for you.
Yeah.
And that's for me, that's health literacy. That's one of the first books I wrote 10 years ago in German. So I can't even offer it here. But that's how you do it. And the second question was how often you should see a doctor.
Almost like on a preventative basis,
Yeah.
To go in and get
If you're generally
your oil
well.
changed and your...
Yeah.
That's a
good
brilliant
metaphor.
question.
Yeah.
Because this is about the checkups.
Yes.
So prevention and checkups are something different. So prevention is something you do to stay healthy, and checkups are something you do to spot something early on. You cannot prevent it, but you can detect it so early that you still have the best chances to do something against it.
Right.
A cancer screening will not keep you from getting that cancer. It will just help you to detect it very early,
Right.
Okay.
so that you have the best chances to treat it.
Right.
The screening, going as a woman going to a breast cancer screening, as a woman or man going to a colonoscopy. The colonoscopy doesn't keep you from getting the cancer. It just helps you to find it before it becomes a big problem.
Yeah.
And that's something which I think there's a misconception. People always think like, I don't even need to go there. I don't have it anyway. Or, if I get it, I get it. It's just, these checkups are made for catching things very early, that they are small problems, manageable problems before becoming big ones. And comparing that with trying to stay healthy. I mean, we are well into the new year. All the New Year's resolutions, I think they're gone by the 19th of January, statistically. So it's prevention and living healthily is small decisions, small routines. It's instead of sitting down after dinner and watching 2 hours of Netflix, is going for a walk and going to bed early.
Yeah.
Instead of taking the lift, taking the stairs. So this is what prevention is, to keep you from it, and then combining it with preventative checkups is something which works very well. So I would say check your policy and the recommendations for what checkups there are offered by your insurance, and also brilliant. Go to tools like Perplexity, ChatGPT, etc., and say, well, I'm for a 42-year-old woman with no physical conditions, what are the recommendations by national guidelines or medical guidelines to what checkups to get? And then you can discuss this with the customer service, for instance.
See, I said I wanted to come back on this AI point as well. And it was interesting because we talked about health literacy earlier, and we talked about how important emotional literacy is as part of health literacy. That ability to walk into the GP or the practitioner and talk about what's actually, get past that shame. How important is that? It's almost prompt literature or AI literature. In fact, how you ask the question. Because there is this rising knowledge that if you ask almost like a preloaded question of AI, you'll get the answer you want from it. So how actually to ask AI or use these tools in the most effective way so that you're not influencing the outcome, but actually getting genuinely useful information.
And the same is true with your doctor.
Yes.
If you are filtering your symptoms down because you're 100% convinced that your headache is a migraine,
Yeah.
and you only present the symptoms to your doctor which point to a migraine, but don't talk about all the other symptoms you have, well, what's the doctor supposed to do? The doctor can only work with what he or she gets of information from you and then running tests. But migraine, for instance, very difficult to run any tests. So they would have to work with the information you provide. Same with these AI tools.
Yeah.
Why not ask the AI tool the question you asked, like, how would I present this to you and to a doctor so that I have a chance to really, see the overall spectrum, and what sources should I point out where you look? That's the beauty about these AI tools compared to a stupid search engine where you type something in and whatever is loudest on the web comes up.
Yes.
Here you can
Or page.
actually you can tell the tool where to look.
Right.
So if you tell the tool, I don't want to see all this nonsense, stick to solid medical knowledge.
Yes.
You don't even have to say guidelines. Just stick to science. It's the best. If you are already down the road of a certain condition, I would even recommend reading original scientific papers. People always think like it's impossible to read them. It's actually not that hard. You find them online. Most of them are open access now. Back in the day, you had to pay for them. Now they're open access. And there's reviews or meta-analyses which combine all the literature there is. And all of a sudden, you start to read and you're like, oh, this makes sense. And I see myself.
I think as a doctor, it would make sense.
You can look up words you don't understand, but
yeah.
the introduction usually is made that everybody who is not an expert in the field can understand.
Yeah.
The middle section about the data, don't even read it,
Yeah.
and then go back to the end of the conclusion. Or take that paper and ask an AI tool to translate it for you.
Yeah.
I think this is important, that we help the tool. It's like, I don't want to say shooting a rifle, but let's say we had to hunt. We were in the woods and we had to hunt. You're not just shooting randomly. You have a scope and you look at whatever animal you want to hunt to provide food for the family, and then you shoot. You don't just like shoot around.
Can I just ask something? I feel that in instances like that, it's also, yes, trying to be very open and upfront about the main topic. So addressing the elephant in the room, which sometimes people are a little bit fearful and reluctant in the first place, but they happen to find themselves in the doctor's office. So that's a huge step. But what about, because it's a very kind of personal, subjective process, there are certain things that unknowingly, as a patient, they seem to filter out, and they focus a lot on the actual physiological symptoms that are being presented, but they fail to take notice of other things that are probably underlying that the doctor would never know unless the patient presents, but the patient themselves are not aware.
That's usually the part where a good professional pattern comes in. In the US, you have to show as a young doctor that you're able to follow a certain almost algorithm of questions that you don't miss out. If you are an engaged doctor, you'll find that many times you'll have a patient who will get these big eyes and look at you and like, nobody ever asked me this. This is actually like ABC. And they come up, they know it. You are the person who's asking the questions to extract that knowledge.
Yeah.
I'm not demanding of any patient that you are like homework, providing the perfect essay on your own issues. That's why I say even presenting your issues is not the main thing. The main thing is that you have to know what you want. Do you want to have a quick fix? Do you want to have the second opinion? Do you want a diagnosis? People often think, it's obvious of what I want. He's supposed to help me. No, well, how is he or she supposed to help you? And usually the doctor then should ask questions which you didn't even think of.
Right.
So that's not your job.
Okay.
It's the same with the lawyer. If I came to a lawyer with my problems and elaborate on the problems, and he would say, okay, that's enough. Let's just do the work. A good lawyer will ask a lot of questions. And by these questions, and I've been lawyered up 1 or 2 times, so you're like, oh,
yeah,
wow. And that's distinguishing a good professional from a bad one, and that's also distinguishing a good medical doctor from an AI tool, which usually doesn't ask questions. It will always try to offer a holistic answer right away and not saying, okay, let's elaborate on this. These tools start to get there, but they are not there yet.
Okay.
It's unbelievable how fast this conversation
Yes,
is
yeah.
going, because the time is ticking away from us. So I need to sneak in our second poll, which does connect to what we were talking about earlier. So the questions will come up on the screen again. This is a fascinating question. What is your main source of health information? My doctor or the healthcare professional? My health insurance provider, ConnectForHealth. Hi. Family and friends, online search or health websites, social media, or AI tools, for example, ChatGPT. What would you think would be the most popular these days, Dr. Johannes?
Definitely not the doctor, not the insurance. Back in the day, it was family.
Back in the day, it was family.
Going back to my grandmother, when she was meeting with her friends,
Yes.
they were sitting there knitting, and just randomly, everybody was able to talk about their ailments, and everybody had to listen, because otherwise you weren't allowed to talk about your own ailment. My guess is that right now it's still regular online search. If you look for something, if you just get info because it's coming to you, then social media probably. I mean, there's a huge difference between do I have a question and I want to look it up, or do I get presented knowledge?
Yeah.
And that's also a huge difference in the way I do videos in Germany, for instance. Are these videos more like medical entertainment? We call it medutainment, medical education and entertainment. Okay. Or are they very specific videos I do for pediatric oncology, so for kids who have cancer and their families? You have different clicks, maybe 1,000 views, which are much more important to me than 1 million on a different video. But I would say that most people say health knowledge presented to them is via social media. And if they look something up, I would say right now more Google, but increasingly ChatGPT.
Mesa, where do you think you get? And you're in healthcare, so.
Yes, I am. I mean, in all honesty, I will not lie. I will say that I get a lot of, I think it's my algorithm on social media. So I'm very much into biohacking and really trying to listen to all of these podcasts, but everybody is now a subject matter expert. So I get all of these talks and all of these testimonials and all of these, and they're always kind of like coming through. So it's social media, unfortunately.
Well, because you look for the first one, and then the algorithm just gives you more and more and more and more of that.
Yes, and you go down a rabbit hole.
Does actually give you cause for hope, perhaps? I mean, you've nailed it. Actually, the top answer is still online search and health websites. But, and again, I guess highly educated audience, well done. Actually, the second best answer, and a third of the people, is that my doctor or the healthcare professional. So congratulations to you. Sachin's making a point, and I wanted to give him his moment in the sun about the business model of healthcare these days. And often doctors can be in, or his impression, and this is only his impression, is that because it's a business, doctors are there to meet business targets rather than the noble profession of serving human beings in a way. What's your assessment of that in this modern age? And is that going to change? And I'm going to have to ask you to keep your answer to that tight as well.
Yeah.
It's a tight one, a tough one.
Right now, the healthcare system, almost any healthcare system around the world, is paying for medical professionals doing something. They pay for the performance, not for the result. So there's a German saying, if you have a hammer in your hand and you walk through your house, you see nails everywhere you want to hit. And if you get paid to hit anything which looks like a nail, you will hit everywhere. So I think the incentive in the healthcare system is utterly wrong. People get paid for doing something, not for the effect of doing it.
Right.
So if we switch this around and say, well, we pay for a good result, they would say, well, but then I won't operate on a 92-year-old lady to get a new hip. Well, if it doesn't help, why would you do it?
Yes.
And I think today we have the means of data to see, does it make sense or doesn't it make sense? Again, I can only say for Germany, we are world champions in surgeries in some kinds, back surgeries, hip and knee replacements. Why are we putting 2 times as many knees into human bodies than other European countries.
Yeah.
Okay.
There must be a wrong incentive. So that I think it's absolutely true. I loved military psychiatry or military medicine working there, because there was not about money. It was about getting the soldier back on their feet and integrate them into their duty again. That was our job.
Right.
And we wouldn't get paid more or less. It was expected of us. I think it will have to change, but the system is very rigid, and maybe we can do this mutually.
Yeah.
It will take a long time, because it's working like an economy. The state hospitals are vanished. Somebody had the idea to privatize everything. I think it's difficult.
It is.
It's going to be interesting with, say, AI. You talk about the data, whether AI can help us answer that question moving forward. But Sachin, I hope that answers your question. I thought that was a great response. We have got about 5 minutes left. So proactively, if somebody wanted to improve their health literacy today, having listened to you, Dr. Johannes, what are the top 3 things they could do immediately? What would you advise?
I've been raised Catholic, and so I had to study the Bible very hard. And the Bible has a few interesting stories which help you to understand what makes sense and what doesn't. I hope I don't get too religious here, but Noah's Ark, the big rain, and he was saving 2 of a kind.
Yeah.
And the analogy is, when did he build his boat? Before the rain. And that's why I'm doing the circle around the Bible, because it's just a good story that you prepare before it's happening. He didn't start building the boat when the rain was already up to his knees. He built it beforehand, and there will also be similar parts in the Quran or any other history and novels, etc. It's about preparedness, doing something before it happens. So health literacy, what you can do is make up your mind what you want before the rain, before it hits you, before you get into the crisis, before you get into the problem. So think about what you want now while you're healthy. If disease hits you, if something bad happens to you, and what you want, what is the part of medicine you want to see. And then also write down your information clearly, that you have like a 1-pager where you say age, gender, medication, symptoms, problems, diagnoses, prior diagnoses and surgeries. This helps professionals a lot. And with these informations and your mindset, you can change quite a bit, and then look up questions before you go to any specialist. What would be the best questions to ask in this circumstance? Like with surgery, is there another option? What do I have to look out for? And then also, last point, think about the time. We talked a lot about the time before seeing the doctor, and then of the time with the doctor. Also think about the time after the doctor. I said that 99.9% of the time we are without a doctor. So think of the time after. What do I have to look out for to see if the medication works? What are side effects I should see?
It's very important.
What should I do? What should I not do? And when should I come back to you, because the problem is getting worse?
I can see you nodding your head there. Let's stay with that after for the last minute or two that we have.
Yeah, because that was one thing that we were really focused on, which is the before and then when you get in, but what happens after. And there's a lot of onus and responsibility as a person, patient, to ensure that whatever you do with that information, it is on you. So if you're given medication, you have to ensure compliance. You have to make sure. And I'll end it with an anecdote. So a friend of mine who I hope is not listening, she actually has stage 4 cancer, and it's spread through. However, there was a containment, and then she fell off the wagon and stopped taking her medication because she didn't like how it made her feel. But she didn't disclose this to her doctor. And then she went back to her checkup, and there were lesions in her liver. So as friends, we said, well, that was on you. That was your responsibility. For various reasons, people seem to think that it lies at the doctor's door.
That's
But
interesting
there's
because
a
that
lot.
comes back to the physical cost Dr.
Yes,
Johannes was talking about
yes.
of not embracing health literacy.
Yes, yeah.
You cannot
yeah.
delegate responsibility for your health.
You cannot.
That's a problem.
That
It's-
almost feels like a mic drop moment, but I'm going to tease one more mic drop out of you. So one message, whether it be healthcare, health literacy, health insurance, what's the one thing you would like people to take away from today's conversation?
Know what you want.
Know what you want.
And knowing what you want might take some time. You really think about, sit down, take a piece of paper and write down, what do I want from this doctor's visit? What do I want from this physiotherapy session? What do I want? Write it down, put it in your pocket, and don't leave the office before you get it.
Love that.
Yes.
Thank you for being a very educated audience. Thank you for all of your questions and also for taking part in the polls. Dr. Johannes, just in case there was any questions that people couldn't get to, I think we got through most of them, but where can people find you? Where are you on Insta or YouTube, all that kind of thing?
I don't even have an own YouTube channel. I'm providing my videos to other partners. Instagram, LinkedIn. That's the classic. Yeah.
Excellent. Okay, well, thank you very much. Before you go, remember, because we are still in the holy month of Ramadan, check out YouTube or the podcasts, because we do have an excellent episode just a couple of weeks ago about nutrition and fasting and the mental aspect of it during Ramadan. So go check that one out. Also, when the episode closes, we will ask you for your feedback. Please give it to us. It is a gift, we think, and it helps us shape these conversations moving forward. So once again from us, Dr. Johannes, thank you for joining us
Thank
on
you.
Connect for
Thanks, Adam.
Health.
Thank you.
And thank you guys. And we'll see you in a couple of weeks' time for the next episode. Thank you.